Dr. Adalja, should we get excited when we hear about something like this, or should we make sure that we temper that excitement because we don't know yet what the next few months will bring in terms of vaccines?
It's a little bit of both. I think people are very excited that we have positive results from a vaccine using an innovative technology. However, you have to remember this is a phase 1 clinical trial that is very small in nature and is really designed to show the safety of the approach rather than the efficacy or how well it works. And we're going to need to go through phase 2 and phase 3 trials to get a better idea of how to dose this and what the safety profile is in a larger group of people, and to see exactly what the antibody levels generated are. So it's great news, but we have to do more follow-up before we can really be excited about it.
So obviously we're seeing a lot more places reopening and a lot of social distancing measures being maybe a little bit relaxed, more businesses opening and so on. Has the virus gone away, Dr. Adalja? Is it safe for any of us to just walk outside our door and participate in what's clearly being allowed to happen outside now?
You have to remember that the virus didn't magically disappear. This virus has established itself in human populations, and it's going to be with us until we have a vaccine. So no activity is going to be risk-free. That being said, social distancing was primarily put into place to make sure that our hospitals didn't exceed their capacity, like we worried about in New York City and like what happened in northern Italy. Now that the hospital capacity may be in a better position, we have to really think about what our individual risk tolerance is and use a lot of common sense. And for those in vulnerable populations, like the elderly and other medical conditions, they're going to probably continue to want to social distance as best they can. But for everybody else, they have to look at their hierarchy of values, what's important to them, what's not important to them, and make the best decisions that they can do as states reopen all across the country. But the virus is still going to be there, and there are going to be more cases and more deaths, but hopefully at a lower rate so hospitals are not overwhelmed.
Yes, I know you say that social interaction is going to lead to more cases, more hospitalizations and more deaths, and so that's quite a scary thing. Briefly, does that mean that schools definitely won't be able to reopen properly without a vaccine?
No, I don't think that's the case. There are already in the United States some private schools that have opened in Idaho and Montana, for example. But what I think we have to learn about is the role of children, and we haven't seen much data that children actually spread this infection. We know they get infected. We know they have the virus in their nose. We know they have a lot of contacts. But have there been outbreaks that have been driven by children? And I think that's something that's really important. And do you get a marginal benefit with other social distancing?